Welcome everybody to Chronic Fatigue and Fibromyalgia Update. I am Dr. Richard Podell, and today we have a great treat for all you folks with fibromyalgia and or chronic fatigue syndrome who know that you want to exercise, who know that if you don't exercise you tend to get worse, but also know if you push too hard in exercising you also get worse. So today we have our guest expert, who's Dr. Kim Jones, who is perhaps the leading expert in the world on exercise and fibromyalgia, certainly one of the leading clinicians on fibromyalgia, and she's going to talk with us today in 3 segments to give us very practical advice on how to be able to exercise safely, effectively, and have a sense of achievement when you're done. Now, Dr. Jones is an associate professor in the School of Nursing at the Oregon Health and Science University. She's also president of the Fibromyalgia Information Foundation. Kim, you've written extensively on exercise with fibromyalgia. I know there are a lot of practical points. How do you do it so as not to hurt yourself, how to not get discouraged, and how to get to a better level of physical fitness so that you begin to feel better? So, what's your number one piece of advice?
Thank you, Dr. Podell. I think the most important thing is to put exercise in the context of how to feel better and why it is you want to exercise. We know that fitness is low in people with fibromyalgia. Cardiorespiratory fitness is very low, strength is very low, flexibility is limited. Most recently, we found that the average 40-year-old with fibromyalgia has balance scores as someone who should be 70 or 80. So a lot of the accident proneness that sort of gets blamed on fibromyalgia may actually be in part due to deconditioning. And deconditioning feels like worsening fibromyalgia. So there's not a pill in the world that I can prescribe that will help people feel their best if they're not also exercising. The good news is that all the components of fitness, balance, strength, flexibility, cardiorespiratory fitness, can be improved in fibromyalgia. This is not a disease like multiple sclerosis where the nerves and the muscles don't talk to each other and it's not possible to retrain parts of the system. Everything is retrainable. So what I want to do is condense what I used to call 29 practical strategies to modify exercise for persons with fibromyalgia down to 12 practical strategies. See if I can choose the top 12 that are the best. The first one that I want you to think about is keeping movements near the body's midline, especially during warm-up. And this may reduce immediate or delayed onset muscle soreness, which you've probably all experienced when you've been told to go out and exercise. You may have even gone to a very mild senior sneakers type class at the YMCA and still ended up on the couch for 2 weeks in a fibroflare after that. So a very gentle workup. If you could picture in your mind the little gopher from Caddyshack and his dance that he does when he comes out of the hole to pester Bill Murray, that's an example of a way we warm up with fibromyalgia. So close to the body's midline, small movements to warm up. So this is important as the beginning of exercise.
Okay, what happens if you go outside the midline? If you go like to brush your hair and you lift your arm way up? What's wrong with that?
I think for what we would call brushing your hair, things like activities of daily living, we certainly want to go outside of that area. We don't want people with fibromyalgia to end up with limitations in their shoulder range of motion or a frozen shoulder. It's just that we don't want to spend a lot of time actively exercising there. So the second point is exactly what you're talking about. We want to limit time spent with arms overhead. So we don't want to do weight training for the tricep, etc., by lifting a weight over our head several times. Instead, we'll put it in front of us to the midline of the body and work that same muscle closer to the midline of the body. But gentle stretching overhead and doing things like brushing your hair, things like that are fine overhead. Without getting too scientific, I would tell you that people with fibromyalgia have problems with growth hormone production. This is an anabolic steroid that helps repair your tissue, particularly at night when you're getting good sleep. As you know, with fibromyalgia, you'll often wake up the next day feeling like you've had no rest whatsoever, and you don't feel refreshed. So when you have these little micro tears in your muscle, it doesn't take much activity to produce pain or even a pain flare. So we're going to ease into exercise partly by limiting stress on an elongated contracted muscle. That's called an eccentric muscle contraction. Another way we do that is that we let muscles rest by alternating sides. In other words, we don't lift one weight 8 times with our right arm and then the weight 8 times with our left arm. We might alternate right, left, and even beyond that, knowing that we might have these tiny tears in our muscles, people with fibromyalgia are aware that they can just look at their muscle and sometimes see it twitch or move uncontrollably, and we think this is related in part to microtrauma and in part to deconditioning. So when you're not actively lifting the weight, we want you to put the weight or the TheraBand or the TheraBall down on a table or a hard surface so that your muscle can completely relax and unload. And sometimes you need to even jiggle your arm or your leg a little bit to get your muscle back to a resting baseline state. The next strategy I would tell you is to gradually increase time on your feet. In the beginning of exercise with fibromyalgia, this is not possible for everybody. Some people are going to be in scooters or some sort of wheeled device, and moving their trunk and their upper body is a great start, but eventually we want to get people with fibromyalgia onto their feet. So some people like to do this in a very controlled temperature and surface environment, like inside a mall before a mall opens, or a mall walking clubs, for example. Other people are much more drawn to walking outside, and there's some very nice literature about the benefits of being outside to exercise, and a group out of Denmark did a nice study using Nordic track walking poles to help you be more safe when you're walking outside. It puts a little load on your chest and shoulders and arms, gives your lower body a little bit of a break, and helps reduce the risk of falling. So you can get up and down off of a curb and up and down small hills without that being a problem. My only comment about this is I've had patients get so excited about using their trekking poles that they've trekked too far from home, meaning too far from a bathroom. And many people have irritable bowel and irritable bladder, and it's not fun to get caught too far from a bathroom when you have that. So I've had other patients that use their trekking poles outside but make small circles around their neighborhood so that they're always fairly close to their house. So I think that would be my first major recommendations about how to modify the exercise prescription with fibromyalgia.
You know, that's wonderful advice. I think each of these points that you've made are going to be very, very useful. The question that I have is, how do people know if they've done too much? I mean, traditionally people, get tired when they're doing stuff, but people with fibromyalgia may not get terribly tired, or they may feel they need to push through a little bit, and then hours later or the next day they're going to be worse. So how do they get a sense of what's too much before they actually get the collapse?
That's a great question, and there's not a good answer, but here's what we tell our patients. Do about 80% as much as you think you need to do, and then stop and see how you feel for the next 48 hours. If you feel pretty good, the next time we get together and exercise, you're going to do just a little bit more than you did the previous time. So with fibromyalgia, it's better to underdo it just a little than to overdo it. And it is a challenge because you, especially in a group environment, you get caught up with how fun it is, or some people are even a little bit competitive and want to try to do what their neighbor is doing. And so it's easy to overdo it with fibromyalgia, but our goal is to be able to come back in 2 days and do it again. So we'd prefer that people underdo it a little.
Okay, so I think that's very important advice. So this is the end of segment 1. We have 3 segments because each segment is going to talk about other specific bits of advice that you can use if you have fibromyalgia or if you have chronic fatigue syndrome. You need to get into better shape, but you want to do it safely. You want to do it effectively, and you want to have a sense of achievement. So our guest is Dr. Kim Jones, and we thank you for being with us in segment 1, and shortly we will be recording segment 2.